Welcome once again, friend. Today we will be discussing a one new topic in the ENT and the question associated with this. So, the question for today is, in this image which is shown, a famous cartoon character of early 90s, which says that what pathological condition is marked by the dotted arrow in the image. So, as we can see that an image is shown to you in which the area in the mandibular region is the structure is absent in the mandibular region. So this area is marked by dotted arrow. So we have to learn today about this deformity, which is commonly known as Gump deformity in ENT practice. So now beginning with, so this condition is known as Gump deformity. So what actually Gump deformity is? This is the anterior mandibular defect that creates the appearance of absent chin and lower lip. So in this as in this image we can show that lower lip is absent as well as the mandible is also absent. So this deformity is known as Gump deformity. Is anterior mandibular defect that creates the appearance of absent chin and lower lip. Going further, what are the causes of this deformity? So this result due to the severely retrognathic lower jaw. Retrognathic means backward push of the lower jaw, which is named after a character in the early 20th century comic strip that is known as Gump, as we can see in this diagram. So most common cause are the head and neck ablative surgeries, and most common surgery nowadays which is being performed which result in Gump deformity is the commando operation, which is used usually for the advanced oral carcinomas which are infiltrating the mandible fossa. So going further, how this deformity leads to complications. So the most common complication of this deformity is airway compromise. Second most commonly, as we can see in earlier diagrams also, it leads to cosmetic embarrassment. Third is excessive drooling. Fourth is mastication difficulties. And 5 is speech impairment. These are the most common complications of this deformity. The first one is airway compromise, second is cosmetic embarrassment, third is excessive drooling of saliva, fourth is mastication difficulties, and fifth one is the speech impairment. Going further, what can be the treatment? Although the reconstruction of this deformity is very difficult, as well as reconstruction about after advanced oral carcinomas is very difficult, but with the use of vascularized bone flaps, the deformity can correct it with more success. With the use of vascularized bone flaps, this deformity can be prevented as well as corrected to some extent with more success. So this finishes with our today's topic, that is Gump deformity, so which is named after a comic character. If you like the video, kindly share and subscribe, and stay tuned for more such upcoming videos. Thank you.